Congratulations on your decision to become a DOT urine specimen collector. This video training and the accompanying manual cover all of the material that you need to know to become a DOT qualified collector. This video includes a quick introduction to 49 CFR Part 40 and a thorough review of specimen collection procedures. It will give you the information and confidence you need to handle uneventful collections as well as any problem situations that may occur. Throughout the video, you will be directed to consult the manual for more detailed information. When the manual icon appears on the screen, you may pause the training and read the applicable text. After you've completed the video training, you should review the manual in its entirety and complete the collector training self-test. You can also review the collection scenarios in the manual's appendix to help you prepare for your required mock collections. With this comprehensive training package, you will be able to master collection procedures, pass your mock collections, and start performing DOT collections in no time. Employers who operate under the jurisdiction of the Department of Transportation, or DOT, are required to comply with a number of safety regulations. In addition to following many other requirements, these employers must have their safety-sensitive employees in comprehensive drug and alcohol testing programs. Designed to protect the safety of employees, co-workers, and the general public, these drug and alcohol testing regulations cover more than 12 million people. Every employee who performs a DOT-designated safety-sensitive function is subject to federal drug and alcohol testing as mandated by their applicable DOT operating agency. These agencies include pipeline workers, truck drivers, ferry operators, train engineers, bus drivers, airline crew, mechanics, and many others. As the collector, you must be knowledgeable about the drug and alcohol testing procedures outlined in 49 CFR Part 40, as well as the urine collection guidelines issued by the Office of Drug and Alcohol Policy and Compliance, known by the acronym ODAPC or ODAPC. In addition, you must be familiar with the specific drug and alcohol testing requirements of the operating agencies that govern the employers for whom you perform collections. The 6 agencies that require DOT drug and alcohol testing are the Federal Aviation Administration, the Federal Motor Carrier Safety Administration, the Federal Railroad Administration, the Federal Transit Administration, the Pipeline and Hazardous Materials Safety Administration, and the United States Coast Guard. It's important that you periodically review Part 40 and the regulations covering the operating agencies that you serve, as these regulations are subject to change. The manual that accompanied this video training includes a brief discussion of operating agencies, their safety-sensitive employees, and the specific regulation numbers that address drug testing requirements. Next, we will take a quick look at some of the key players in the world of DOT drug testing. In addition to you, the collector, and the donor, there are a number of other people, organizations, and entities that play a role in DOT drug testing. We will highlight 5 of these key players in this video. Additional information about these and other drug testing participants can be found in the manual. As the collector, you instruct and assist donors who may be applicants or employees for a DOT-regulated safety-sensitive position. You are the person who initiates and completes the Custody and Control Form, or CCF, and receives and makes the initial inspection of the urine specimen provided by the donor. To be a DOT qualified collector, you must complete the mandatory training and successfully complete 5 consecutive error-free mock collections. A consortium third-party administrator, known by the acronym TPA, is a service agent that provides or coordinates the provision of a variety of drug and alcohol testing services to employers. TPAs typically perform administrative tasks concerning the operation of the employer's drug and alcohol testing programs. TPAs are not employers for the purposes of 49 CFR Part 40. You call the designated employer representative, or DER, when there is a problem, such as a non-cooperative donor, during a collection. The DER is an employee authorized by the employer to take immediate action to remove employees from safety-sensitive duties and to make necessary decisions in the testing and evaluation process. The DER also receives test results and other communications for the employer. The employee, referred to as the donor in this training and on the Federal Custody and Control Form, is any DOT-regulated person subject to drug and alcohol testing. The term includes individuals who currently perform safety-sensitive functions, as well as prospective employees who are taking pre-employment drug tests. An employer is a person or entity employing one or more employees who are subject to DOT drug and alcohol testing. This includes self-employed owner-operators who are considered the employer and the employee. DOT-regulated employees are prohibited from using 5 controlled substances: marijuana, cocaine, amphetamines, opiates, and phencyclidine, or PCP. This prohibition includes any use at any time. In addition, DOT-regulated employees are prohibited from using alcohol while on duty and for the specified time period before beginning a safety-sensitive function or after an accident. The Department of Transportation has identified 6 situations in which regulated safety-sensitive employees must be tested. The following is a quick overview of the 6 DOT test types. Additional information about each test type can be found in the manual. Employees are required to have a negative pre-employment drug test result before performing any safety-sensitive functions. This type of drug test is to be taken by prospective employees, current employees who transfer from a non-safety sensitive position into a safety sensitive position, as well as employees who have been removed from the random selection pool for a period that exceeds the time specified by the operating agency. Random tests are unannounced and occur throughout the year. Each year, the operating agencies determine the random testing rate. The actual selection of employees for random testing is to be made by a scientifically valid method by the entity doing the selections. A post-accident test must be conducted when an employee is involved in an accident that meets the specific criteria as defined by the regulating operating agency. When a safety-sensitive employee shows signs of possibly being impaired by drugs or alcohol, a supervisor who is trained to make a reasonable suspicion determination is to require the employee to submit to a reasonable suspicion drug and/or alcohol test. An individual with a positive test result, refusal to test, or other prohibited conduct event must have a negative return to duty test result before he or she can return to safety-sensitive duties. An individual is placed in a follow-up testing program after having a negative return to duty test result and returning to safety-sensitive functions. As part of a follow-up program, the employee is required to take at least 6 unannounced follow-up tests during the first 12 months after resuming safety-sensitive duties and may be in a follow-up testing program for up to 5 years. Collectors play a critical role in ensuring the integrity of the collection process. That's why the DOT requires that all collectors complete an initial training and perform a proficiency demonstration before conducting DOT urine specimen collections. This requirement applies to seasoned veterans, entry-level collectors, and everyone in between. To remain qualified to perform DOT collections, collectors must complete refresher training every 5 years. Collectors are also required to complete error correction training whenever they make a mistake that results in a canceled DOT test. All collectors who perform DOT collections must maintain documentation that shows they've met the training requirements of 49 CFR Part 40. This documentation need not be displayed. However, upon request, collectors would need to provide this documentation to DOT auditors and employers and third-party administrators who are using their services. Now we will review the initial and ongoing training requirements you must meet to be a qualified DOT collector. In the following scene, Tony, a veteran DOT urine specimen collector and trainer, is educating a recent hire about the steps she must complete to become qualified to perform DOT collections.
Hi, Tony. Do you have a minute?
Sure, Contessa. Come on in.
I was just wondering what the schedule looks like today.
Well, right now it's filling up. We do still have a little wiggle room, but that'll change if we get our usual walk-ins. Why? What's up?
Well, I think I'm ready to start doing DOT collections.
Well, that's great, Contessa. We really could use some more collectors. But before you can do DOT collections, you need to meet the DOT's initial training requirements. This includes 5 mock collections that'll test your understanding of the DOT collection procedure and your ability to handle more challenging collections.
All DOT collectors must be knowledgeable about 49 CFR Part 40, the current urine specimen collection guidelines issued by ODAPSI, and DOT agency regulations that apply to employers for whom they perform collections. A current copy of ODAPSI's urine specimen collection guidelines for DOT testing is included in this training package. Additional copies are available at the ODAPSI website.
Along with the basic information, the DOT states that you must complete qualification training covering the following 4 areas. The necessary steps to complete a valid collection. This includes the completing and distributing of the custody and control form. How to handle problem collections, such as a shy bladder or attempted tampering situations. Fatal and correctable flaws and how to handle them. And the collector's critical part in the collection process. You are responsible for the integrity of the collection process, the privacy of the donor, and the security of the specimen.
After completing qualification training, collectors must complete 5 consecutive error-free mock collections. These mock collections must be performed following the procedures outlined in 49 CFR Part 40. The DOT requires that the mock collections cover the following 5 situations: 2 uneventful scenarios, 1 insufficient quantity of urine or shy bladder scenario, 1 temperature out of range scenario, and 1 scenario in which the donor refuses to sign the CCF and initial the tamper-evident bottle seals. In order to demonstrate initial proficiency, Contessa must complete all 5 collection scenarios without a single error. If she makes a mistake at any point during the proficiency demonstration, even if she is on the last step of the final mock collection, she will be required to repeat all 5 of the mock collections. Like Contessa, you will need to perform 5 error-free mock collections as part of your initial proficiency demonstration. The 5 mock collections must be monitored and evaluated by a qualified individual, such as Tony. Upon successful completion of the mock collections, that individual must attest in writing that the required collections were performed without a single error. The DOT offers specific guidance on who is qualified to observe and evaluate a collector's initial proficiency demonstration. This individual must be a qualified collector and have regularly conducted DOT drug test collections for more than 1 year, conducted DOT collector training for at least 1 year, or successfully completed a Train the Trainer course. To maintain your DOT collector qualifications, you must complete refresher training every 5 years. The required training is to include a regulation review and update, as well as a qualification training review. In conjunction with each refresher training, the collector must again complete the 5 consecutive error-free mock collections covered in the initial proficiency demonstration.
Well, error correction training is the 3rd type of DOT training that may be required of a DOT collector. The first 2 types, initial training and refresher training, have already been covered. Error correction training is required of a DOT collector whenever a test is canceled due to a mistake the collector made. And what this retraining involves is 3 error-free mock collections that must be completed in front of a qualified trainer. So the first 2 types of collections will deal with the specific subject matter that caused the test to be canceled. And the 3rd will be an uneventful scenario. And at the end of these 3 mock collections, the qualified trainer must certify that all 3 of these mock collections were done error-free. Now, the collector has 30 days during which time they must complete this error correction training, starting with the date that they were notified of the mistake that caused the test to be canceled. And if after 30 days they have not completed successfully error correction training, they're no longer qualified to complete a DOT test. Now, during that 30-day period, they can continue to complete DOT collections, but again, after 30 days, they're no longer a qualified collector.
Facilities used for Department of Transportation urine collections must employ qualified collectors and provide the donor with substantial privacy while urinating. Collection sites must also have all of the necessary personnel, supervision, materials, equipment, and facilities to provide for the collection, temporary storage, and shipping of the specimen to the laboratory. 49 CFR Part 40 specifically states that a collection site must have a suitable clean surface for writing. As long as it meets applicable DOT requirements, a collection site may be in a medical facility, mobile facility, a dedicated collection facility, or any other location. However, when a collection room is used for another purpose, such as a public restroom or hospital examining room, the collector must take the following steps to safeguard the integrity of the collection process. Access to the collection materials and specimens must be restricted. The collection room must be secured during the collection to prevent collector distraction and ensure the donor's privacy. Limited access signs must be posted. While DOT collections can be conducted in either single or multi-stall toilet rooms, a single toilet room with a full-length privacy door is preferred. The collection facility must have a water source for washing hands that is preferably outside the closed room used for urination. Additionally, the collector must secure all internal sources of water and other materials that could be used to adulterate the specimen. For example, as the collector, you will want to secure all faucets and soap dispensers with tamper-evident tape. Procedures for securing collection facilities will be discussed in greater detail later in this section. No one other than the donor is allowed in a single toilet room during routine collections. There is an exception for directly observed collections. In these situations, the observer and the donor are the only people permitted in the urination room while the donor is providing a specimen. DOT collections may also be conducted in a multi-stall toilet room, as long as the donor has sufficient privacy. A bathroom stall with a partial door is an example of adequate visual privacy. No one other than the donor is allowed to enter the multi-stall room during the collection. The only exception is for a monitor who enters the multi-stall room for a monitored collection, or the observer who actually enters the stall with the donor to conduct the directly observed collection. When a multi-stall toilet room is used for a collection, the collector has two options for securing the room. The collector may secure all water sources and other substances that could be used for adulteration and blue the toilet water. In this situation, the collector must secure all the toilets, not just the one in the stall the donor will be using. A monitored collection is a more practical alternative. In this situation, the monitor stays inside the multi-stall toilet room where the donor provides a specimen in an enclosed stall. The monitor can listen, but is not to watch the donor provide the specimen. For more information about monitors and monitored collections, please see Part 7 of this training. The DOT requires that collectors and collection site personnel prevent unauthorized access that could compromise the integrity of the collection process. As the collector, you must take the following 8 steps before beginning a collection. Secure all water sources to ensure that the donor does not have access to water during the collection. This can be accomplished by turning off the water inlet and/or securing all faucet handles with tamper-evident tape. Blue the toilet water. This step helps deter the donor from using toilet water to tamper with the specimen. Remove all soap, disinfectants, cleaning agents, and other possible adulterants from the restroom. Inspect the site, including cupboards, ceiling tiles, and garbage receptacles for any foreign or unauthorized substances. Secure the toilet tank top with tamper-evident tape or place bluing agent in the tanks. Make sure that undetected access, such as an unlocked window or secondary door, is not possible. Secure all areas and items that could be used to conceal adulterants. Areas to check include trash cans, paper towel holders, under sink areas, and ceiling tiles. During the collection, there are additional safeguards required by 49 CFR Part 40. They include performing only one collection at a time to avoid distraction. An exception is made for shy bladder situations, which are discussed in Part 10 of this training. Keeping the collection container within view of both you and the donor from the time the employee has urinated until the specimen bottles have been sealed. Making sure that only you, the collector, and the donor handle the specimen before it is poured into specimen bottles and the bottles are sealed. Staying at the collection site from the time the employee gives you the specimen until it is sealed. Maintaining personal control over all specimen and custody and control forms during the collection process. Collection sites are required to implement policies and procedures to prevent unauthorized personnel from entering any area where urine specimens are collected or stored. Only donors, collectors, collection site workers, designated employer representatives, employee representatives, and DOT officials are considered authorized personnel. No one other than the donor must enter the urination room during a collection. Exceptions are made for the observer in a directly observed collection and the monitor in a monitored collection. All authorized personnel must be under the supervision of a collector while they are at the collection site. The collector or a site supervisor may remove any person who obstructs, interferes with, or causes a delay in the collection process. In the next part of this training, we will review the materials that collectors use to perform DOT collections. Collection sites that conduct DOT testing must have these required materials on hand. This section discusses all of the materials that a collection site must have before a DOT collection can begin. In addition to an ample supply of DOT-compliant collection kits, collectors such as you need DER contact information, bluing agent, single-use disposable gloves, tamper-evident tape, and federal drug testing custody and control forms. Before beginning a collection, make sure that you have the name and telephone number of the donor's DER. If there are any problems during the collection process, contact the DER immediately. Problem situations that would require you to contact the DER are discussed in Part 10 of this training. In order to deter the donor from diluting his or her specimen, you must add blue dye to any toilet or toilet tank water that the donor could access. Though not required, collectors should use single-use disposable gloves while handling specimens. Use tamper-evident tape to secure faucets, toilet tank tops, soap dispensers, and other devices that may provide the donor with possible adulterants. The Federal Custody and Control Form is used to document all Department of Transportation urine collections. The initial steps of the 5-part carbonless form are completed by you and the donor at the collection site. Additional steps are completed at the laboratory and by the Medical Review Officer, or MRO. Copy 1, the laboratory copy of the form, accompanies the specimen to the laboratory. You distribute the remaining copies to the appropriate individuals. Copy 2, the Medical Review Officer copy, is sent to the MRO. Copy 3, the collector copy, is retained at the collection site. Copy 4, the employer copy, is sent to the employer. Copy 5, the employee copy, is given to the employee. With the exception of Step 5, the donor's certification statement, the following steps are completed on Copy 1 of the 5-part carbonless CCF. Step 1 of the CCF must be completed by either you or the employer's DER before the employee provides a urine specimen. Subparts A and B, the employer and MRO information, may be pre-printed or handwritten. If a designated service agent is to receive drug test results from the MRO, the service agent's address may be used in lieu of the employer's address. However, in all cases, the employer's name, telephone, and fax numbers must be included on the form. A clinic or collection site name is never to be used instead of an employer name. Continuing to Subpart C, you must verify the employee's identity. Then you record the employee's Social Security or other identification number on the CCF. In subparts D and E, you specify the reason for the test and the type of test to be performed. Since all DOT tests are 5-panel, you check the box next to THC, COC, PCP, OPI, AMP in subpart E. Next, enter the name and address of the collection site as well as contact information. For off-site collections, use the address of the location where the collection was performed rather than the address of the primary collection site. You must also include your phone and fax numbers in case the MRO or laboratory has questions related to the collection. Step 2 of the CCF is completed by the collector after receiving the specimen from the donor. After checking the specimen temperature, mark the appropriate box to indicate if the specimen was in the acceptable range of 90 to 100 degrees Fahrenheit. Put a check next to Split in the specimen collection box. Remember, all DOT collections are split specimen collections. For observed collections, you will want to check the Observed box in Step 2. If someone other than you observed the collection, you will need to include his or her name on the CCF. Step 2 also contains a remarks line, which is often used when a collection deviates from routine procedures. In an observed collection, for example, this is where you would write the name of the observer. Step 3 of the CCF instructs you to seal and date the specimen bottles. Once you have placed the tamper evidence seals on the bottle, date them and instruct the donor to initial them. The 2 tamper evident bottle seals are located at the bottom of copy 1. The label marked with an A is used to designate the primary specimen, and the label marked with the letter B is used to designate the split specimen. Once the bottles are sealed and the seals are dated and signed, the donor completes Step 5 on Copy 2 of the Custody and Control Form. Flip to Copy 2 of the CCF so that the employee can complete Step 5. In this step, the employee is asked to provide personal identifying information that must not be on Copy 1, the copy of the CCF that goes to the lab. Have the donor read the certification statement, print his or her name, provide date of birth, daytime, and evening telephone numbers, and date of collection, and then sign his or her name. After the donor completes Step 5, review it to make sure that all of the required information was provided. Return to Copy 1 to begin Step 4 of the Custody and Control Form. This step is initiated by you, the collector, and completed by the laboratory. You must sign the form to certify that the specimen was collected, labeled, sealed, and released for shipment to the laboratory in accordance with DOT requirements. You must also note the time of the collection, the date of the collection, and the name of the delivery service that the specimen will be released to for shipment to the laboratory. Laboratory personnel will continue the documentation process when the package is opened at the laboratory. Steps 5A, 5B, 6, and 7 are completed by the laboratory on Copy 1. The MRO will complete Steps 6 and 7 on Copy 2. Non-federal custody and control forms should not be used for DOT drug tests. Always check the top of the custody and control form to make sure that it says Federal Drug Testing Custody and Control Form. Non-federal forms also typically include specific instructions at the top advising you not to use them for DOT collections. The appendix of 49 CFR Part 40 includes specific information on what must be included in a DOT collection kit. These required items are a collection container, plastic specimen bottles, a leak-resistant plastic bag, absorbent material, and a shipping container. As the collector, you must ensure that the kits you use for DOT collections meet the requirement. If you discover a kit that has been opened, is incomplete, or has wrongly sized specimen bottles, do not use it for a DOT collection. The collection container must be a plastic single-use container that is large enough to collect and hold at least 55 milliliters of urine. The containers must have a graduated volume marking indicating levels of 45 milliliters or above, as well as a device to measure temperature. The preferred device is a temperature strip that provides graduated temperature readings of 90 to 100 degrees Fahrenheit that is affixed at a proper level on the outside of the collection container. However, other methods are acceptable as long as they are accurate and pose no risk of contaminating the specimen. Each collection container must be individually wrapped or have a sealed lid or some other tamper-evident system. Collection sites must stock a sufficient supply of collection containers in preparation for shy bladder or other situations that require more than 1 cup per donor. Similarly, collectors who do off-site collections should bring an ample supply of collection cups so that they are prepared to handle non-routine collections. There are also a number of specific requirements for the plastic bottles that are used to transport specimens to the laboratory. Since all DOT collections are split specimens, there must be 2 bottles, one for the 30 milliliter primary specimen and one for the 15 milliliter split specimen. The primary specimen bottle must hold at least 35 milliliters of urine, and the split specimen bottle must hold at least 20 milliliters of urine. Both bottles must be made of leak-resistant plastic and have markings clearly indicating the appropriate levels of urine that must be poured into them. The bottles must be wrapped, together or separately, in a sealed plastic bag, shrink-wrapped apart from the collection container, or they must have a peelable sealed lid or other tamper-evident system. The bottles must have screw-on or snap-on caps that won't leak during shipment. They must also accommodate the required tamper-evident bottle seals from the CCF. The seals must fit on the bottles so that they won't be damaged when the collector dates and the donor initials the seals. The bottle should also be designed so that overlapping seals do not conceal information. All DOT specimens and accompanying CCFs must be transported to the laboratory in sealed leak-resistant plastic bags. Each bag must have a tamper-evident sealing system and 2 sealable compartments or pouches that are leak-resistant. One compartment is for the 2 specimen bottles and the other is for the CCF. Each collection kit must also contain enough material to absorb the contents of both specimen bottles. The absorbent material must fit in the pouch of the leak-resistant plastic bag that holds the specimen bottles. A shipping container must be used to transport the specimens unless a laboratory courier picks up the specimens and hand delivers them to the lab. The container can be a standard courier box, small cardboard box, or plastic container. However, it must adequately protect the specimen bottles from damage during transport from the collection site to the laboratory. A DOT urine specimen collection is a multi-step process that requires a significant amount of attention to detail on your part. Ultimately, it is up to you to ensure the integrity of the collection process by following the standard collection procedures and dealing with any challenging circumstances promptly and professionally. In this section, we will review all of the necessary steps for a DOT collection. We will start by discussing what the collector must do to secure the collection site before a collection can begin. The following 8 steps, which were discussed in the facility requirements section of this training, must be taken to prevent unauthorized access and to deter specimen tampering. First, secure all water sources by turning off the water inlet and/or securing all faucet handles with tamper-evident tape. Blue the toilet water to deter the donor from using the water to tamper with the specimen. Remove all soap, disinfectants, cleaning agents, and other possible adulterants from the restroom. Inspect the site, including cupboards, ceiling tiles, and garbage receptacles for any foreign or unauthorized substances. Secure the toilet tank top with tamper-evident tape or place bluing agent in the tank's water. Make sure that undetected access is not possible. Secure all areas and items in the room that could be used to conceal adulterants. Always double-check to be sure that you have completed the previous 7 steps. You must pay close attention to the donor from the time he or she arrives at the collection site until the collection is completed. Never delay the collection process because the donor says he or she is not ready or able to provide a specimen. Also, you should not wait for authorized representatives of either the employee or employer to arrive. There are, however, a couple of situations that take precedence over a DOT urine drug screen collection. If a DOT alcohol test is also required, it should be completed before a urine collection. Medical treatment must never be delayed for a urine collection. For example, in a post-accident testing situation, the donor must receive necessary medical attention before a collection is attempted. If a donor fails to arrive on time when you have a scheduled appointment for a DOT collection, you must notify the DER. During this conversation, ask the DER to authorize a cutoff time for the donor's arrival. If the donor does not arrive by this time, call the DER and tell him or her that the donor has not reported for testing. The DER will determine whether the time lag or no-show constitutes a refusal to test. When the donor arrives at the collection site, you must verify the donor's identity. Acceptable forms of identification include a photo ID issued by the employer or a photo ID issued by a federal, state, or local government, such as a driver's license. Faxed or copied IDs or identification by a coworker is not acceptable. Contact the DER to verify the donor's identity if the donor cannot provide a valid ID. If the donor's appearance matches the physical description provided by the DER over the telephone, it is an acceptable form of positive identification. An exception to the general rule is made for owner-operators who fail to bring a valid photo ID to the collection site. In this situation, you can accept 2 non-photo identification cards with the donor's signature. Compare the signatures on the cards with the donor's signature on the CCF, and also make a note in the remarks line of the CCF stating that was the ID verification procedure that was used. Be prepared to present identification to the donor if requested. Your collector ID should include your name and the name of your facility. You are not required to provide a photo ID, address, telephone number, or proof of training to a donor. Employers, third-party administrators, and auditors, on the other hand, can request proof of collector training, including initial training, refresher training, and error correction training. Once the donor has been properly identified, explain the collection process to him or her using the instructions on the back of the CCF. Tell the donor that he or she may write down any medications that he or she is taking on the back of the donor copy, copy 5 of the CCF at the end of the collection process. Next, you begin filling out Step 1 of the CCF. This includes employer name, address, telephone, and ID number, and the MRO name, address, phone, and fax number if it is not already completed. On pre-printed forms, verify that the employer and MRO information is correct. You then fill in the donor's Social Security number or employee ID, specify the reason for the test by checking the box for pre-employment, random, reasonable suspicion, post-accident, return to duty, follow-up, or other, as well as the type of testing that will be performed. For all DOT collections, check the first box next to THC, COC, PCP, OPI, AMP to indicate that the 5-panel test with established cutoff levels is to be performed. The collection site address is also documented on the CCF. Once the preliminary paperwork is completed, ask the donor to remove his or her outer clothing and empty his or her pockets. Outer clothing includes jackets, coats, hats, coveralls, or other apparel that could be used to conceal items that the donor could use to tamper with the specimen. Hats or head coverings worn as part of a religious practice, work boots, and cowboy boots do not need to be removed, unless the collector has reason to believe that the donor is using them to conceal something that will be used to tamper with the specimen. For standard collections, a donor is never asked to remove other clothing, such as shirts, pants, dresses, or undergarments. The donor need not wear an examination gown as part of the collection process. An exception can be made for a donor who is undergoing a DOT-authorized physical at the same time as the drug test collection. You ask donors to empty their pockets so that you can make sure that they do not contain any items that could be used to tamper with the specimen. Make sure they empty all pockets, not just the front ones. If you determine that any of the pocket items, such as eye drops or nasal spray, could be used for tampering, you need to make a judgment concerning the donor's intent. Did the donor bring the items to tamper with the specimen, or did he or she bring them inadvertently? If you believe that the donor did not intend to compromise the integrity of the collection process, you should simply retain the questionable items until the collection process is complete. However, if you believe the donor brought the items to tamper with the specimen, you must conduct a directly observed collection. The specific procedures for, in addition to other circumstances that trigger, a directly observed collection will be discussed later in this training. The donor leaves any outer clothing, as well as any briefcases, bags, purses, and other items, in a locked closet or cabinet or other mutually agreeable location. This is also where any pocket items that could be used to tamper with the specimen are stored. Provide a receipt for the items if requested by the donor. The donor is allowed to keep a wallet as well as any pocket items that could not be used for specimen tampering. If the donor will be taking the wallet into the urination room, ask him or her to open it and show it to you so that you can check for possible adulterants. Next, tell the donor to wash his or her hands. This is a necessary step to ensure that the donor does not have anything on his hands, such as an adulterant or motor oil, that could interfere with the test results. Once this is completed, the donor's access to water is restricted until the collection process is complete. When a donor fails to wash his or her hands as instructed or fails to cooperate with any part of the testing process, you should end the collection and note the refusal. More information about refusal to test situations is found in Part 9, Problem Collections. Once the donor has washed his or her hands, an individually wrapped and sealed collection cup is selected by either you or the donor. The collection container must be unwrapped with the donor present. The collection container is kept in view of both you and the donor throughout the collection process. The selection of the collection cup officially marks the beginning of the collection process. If the donor in a pre-employment test leaves the collection site before selecting a collection cup, it is not a refusal to test. However, if the donor leaves after the collection cup has been selected, but before the test is completed, note the refusal and contact the donor's DER. You then instruct the donor to go into the collection room and provide a urine specimen that is at least 45 milliliters. Also, tell the donor not to flush the toilet. Remind the donor that the temperature of the specimen must be between 90 and 100 degrees Fahrenheit. Therefore, if there is a delay in providing the specimen to you, it could result in a specimen with a temperature that is out of range, which would require him to provide a second specimen under direct observation. The specimen temperature is to be checked within 4 minutes. Stand outside the collection room while the donor urinates. Listen carefully for sounds such as excessive rustling, flushing, wrappers opening, or ceiling tiles moving that may indicate that the donor is tampering with the specimen. A reasonable time limit may be set for the collection. When the donor exceeds that time limit, you may knock on the door to check in with the donor. When the donor hands you the specimen, you must verify that the donor provided a specimen of sufficient volume. If a donor's specimen is less than the required 45 milliliters, follow the shy bladder procedures outlined in Part 9, Problem Collections. You must also check the temperature strip to make sure that the specimen temperature is within the acceptable range. Make sure the temperature is between 90 and 100 degrees Fahrenheit. If the temperature is within the acceptable range, check the Yes box in Step 2 of the Custody and Control form. When the temperature does not register in the acceptable range and feels cool, check the No box in Step 2 and include specific information on the remarks line. If the temperature is greater than or less than the acceptable range but is warm, pour the specimen into another collection cup and read that cup's temperature strip. When the specimen temperature is out of range, a second collection must be conducted under direct observation. You must also inspect the specimen for unusual colors and the presence of foreign objects. If you determine that the donor has tampered with the specimen, include pertinent information pertaining to what you see and/or smell on the remarks line on Step 2 of the CCF. Then immediately begin a second directly observed collection. All DOT urine specimens are split. This gives the donor the opportunity to have a second specimen tested at a second laboratory if he or she challenges the MRO's verified result based on the first lab's result. Your collection kit should contain 2 specimen bottles, which must be unwrapped and opened in the donor's presence after he or she has provided a specimen. The specimen bottles must be kept in view of the donor until the bottles have been sealed and the donor has initialed them. This proves to the donor that it is his or her urine, not someone else's, that is being sent to the laboratory along with the appropriate CCF. At least 30 milliliters of urine should be poured from the collection cup into the primary specimen container. Then pour at least 15 milliliters of urine into the second container. This specimen will be used in the event that the donor requests a split specimen test. Carefully close the lids and seal both containers. Check to make sure the lids are tightly sealed. Then check Split in the specimen collection field on Step 2 of the Custody and Control form. Remove the bottle seal labels from the bottom of the CCF and place them over the lids and down the sides of the specimen bottles. The label marked A is used to seal the primary specimen bottle, and the label marked B is used to seal the split specimen bottle. You then write the date on the tamper-evident bottle seals. Though it may be easier to write on a flat surface, DOT collection procedures require that you date the seals only after they are affixed to the bottle. Instruct the donor to then write his or her initials on the bottle seals to certify that the bottles contain the specimen he or she provided. When dating and initialing the seals, both you and the donor should be careful not to damage the seals. Examine the seals after the donor initials them to make sure they are still intact. You may now discard any excess urine that remains in the collection container. Once the specimen bottles are sealed and you have discarded excess urine, have the donor complete Step 5. Without detaching Copy 1, open the Custody and Control Form to Copy 2 and instruct the donor to read and sign Step 5, the certification statement. Next, you initiate Step 4 of the CCF by signing and writing down the time and date the specimen was provided. Write down the name of the courier service that will be transferring the specimen to the laboratory. To prepare the specimen for transport to the laboratory, place the specimen bottles and Copy 1 of the CCF in the plastic bag that was included in the collection kit. Place the 2 specimen bottles and the absorbent material in one of the bag's pouches. Fold Copy 1 of the CCF into fourths so that Step 1 is visible, and put the form in the other pouch of the bag so that the information can be easily read when it is removed from the pouch at the laboratory. When the specimens and CCF are in the bag, adhere the seal. Once the bag is sealed, the collection is complete. Tell the donor that he or she may leave the collection site. Review the CCF to make sure that all the information is complete and legible. After you complete your review of the CCF, remove Copy 5 and give it to the donor. You may remind the donor that he or she can write down any medications he or she is taking on the back of that copy of the CCF. All specimens must be shipped as soon as possible, but no later than 24 hours from the time of the collection. There are 2 ways that specimens are transported from collection sites. They are either delivered by a courier or shipped. In either case, proper packaging is necessary to ensure that the specimen bottles are not damaged while en route to the laboratory. Should there be some leakage, testing can still be conducted. However, excessive leakage may result in a canceled test and may require you to complete error correction training. More information on this and other collection flaws will be discussed in Part 10, Collection Flaws, and Part 11, How to Correct Common Collection Errors. To prepare the donor's specimen for shipment, place the sealed bag containing the CCF and specimen bottles in a sturdy shipping container and seal appropriately. More than one sealed specimen bag may be placed in the same shipping container, as long as they are going to the same laboratory. Copies 2 and 4 of the Custody and Control Form must be distributed by confidential and secure means. Due to tight time frames, copies must be distributed within 24 hours of a collection or the next business day. Fax and email are generally considered the best and most time-efficient methods for distributing CCFs. Copy 2 of the CCF is faxed or scanned and emailed to the Medical Review Office, and Copy 4 is faxed or scanned and emailed to the employer's DER. Copy 3 of the CCF must be retained at the collection site for at least 30 days. A monitored collection is performed when a multi-stall bathroom is used for collections. A monitor doesn't need to be a trained collector, but must be the same gender as the donor, unless the monitor is a medical professional. Doctors, nurses, physician's assistants, technologists, and other medical professionals can perform a monitored collection on a donor of an opposite gender. If the monitor hears sounds or makes other observations that lead him or her to believe that the donor is trying to tamper with the specimen, a second collection must be made under direct observation. For a monitored collection, the room must be secured to ensure that no one besides the donor and the monitor enters the room during the collection process. You may hang a collection in progress or similar sign to let others know that the room is occupied. While the donor provides the urine sample, the monitor must be in the multi-stall bathroom. The monitor must be outside the donor's stall with the door closed. The monitor does not watch the donor urinate in a monitored collection. The monitor does make sure that the donor takes the specimen to you, the collector, as soon as the donor leaves the stall. The monitor must also watch the donor hand the collection cup to you. The monitor is there to watch. He or she is not part of the collection process in any other way. Make sure that your monitor does not take the specimen from the donor. The monitor's name must be included in the remarks line of Step 2 of the custody and control form. Once the donor hands you, the collector, the collection cup, you can follow the collection procedures outlined in the previous section, Specimen Collection Procedures. Directly observed collections, in which the collector must watch the donor urinate into a collection cup, occur in a few specific circumstances. Keith Goslin, a veteran collector at Foley Services, who conducts thousands of DOT urine specimen collections each year, will discuss when and how directly observed collections are conducted.
When doing a DOT directly observed collection, the collector has to be the same gender as the donor. Even in the medical field, a female doctor cannot do a direct observation on a male donor. If someone else in the collection site is of the same gender, they can do the observing part. You don't need to be a trained collector to do an observed collection. If there's no one at the collection site, you can always notify the employee's DER. They might be able to send down another supervisor that can observe the collection. It can't be their coworker or their immediate supervisor. If you do a direct observation, you need to tell the donor why. You have to do a directly observed collection when the donor's employer asks you to do so. When the donor comes in, when he empties out his pockets, if you see anything in there that looks like it was brought in to tamper with. When the donor comes out of the bathroom with the specimen, if the color's really off or you have a strong odor to it, and you believe it's tampered with, at that point you have to do a direct observed collection. If the temperature is not between 90 and 100 degrees Fahrenheit, at that point you have to do a direct observation too. It's a temperature out of range. DOT, return to duty, and follow-up tests have to be done in direct observation.
Mark the reason for the test in Step 1 of the CCF and check the Observed box. In the remarks area, enter the reason for the directly observed collection. If someone other than the collector will be observing the collection, the observer's name is also written on the remarks line in Step 2. When two specimens are being sent to the laboratory because of suspected tampering or a temperature out of range situation, include the specimen ID number of the corresponding custody and control form in your note on the remarks line of Step 2 of the CCF. As Keith just mentioned, the observer must be the same gender as the donor. Before the donor provides a urine sample, the observer must check to make sure that the donor is not concealing a device that could be used to produce a substituted specimen. Specifically, the observer must ask the donor to raise his or her shirt, blouse, skirt, and/or dress above the navel, and lower pants and/or shorts and underpants to mid-thigh. With the applicable clothing raised and lowered, the donor must turn around to show the observer that he or she is not concealing a prosthetic device. After the check, the donor may return his or her clothing to the proper position to provide the specimen. The observer must watch the donor urinate into the collection container. This means that the observer must be present in the collection room with the donor and must watch the urine go from the donor's body into the collection cup. Mirrors or video cameras cannot be used in directly observed collections. In situations where a collection is being conducted in a multi-stall bathroom, the observer must enter the stall with the donor. When the observer is someone other than the collector, the observer is not to take the specimen from the donor. The observer must, however, watch the donor hand the specimen to you. Once the donor hands you the collection cup, follow the remaining routine collection procedures outlined in the previous section, Specimen Collection Procedures. There are a number of situations that require the collection process to deviate from standard collection procedures. These situations include refusal to test, shy bladder, temperature out of range, specimen tampering, and donor refuses to sign. In this section of the training, we will explain each of these situations and offer guidelines for dealing with these challenging collections. A donor who refuses to take a DOT drug test faces the same consequences as a donor who tests positive for a DOT prohibited substance. An exception is made for pre-employment tests as long as the collection process has not begun. There are several instances that the DOT defines as refusals to test. Many of these situations are directly related to the collection process. So it is critical that collectors, such as you, know the proper steps for handling these problem collections. If a donor refuses to participate in any part of the collection process, end the procedure immediately. Write refusal to test on the remarks line in Section 2 of the CCF and distribute the copies of the CCF. Copy 5 goes to the donor. Copy 2 is transmitted to the MRO within 24 hours or the next business day. Copy 4 is transmitted to the DER within 24 hours or the next business day. And copy 3 is retained at the collection site for 30 days. You do not send the specimen or copy 1 of the CCF to the laboratory in situations where the donor refuses to participate in the collection process. Call the employer's DER and tell him or her what has happened. The employer will determine whether or not the employee has refused a required test. A refusal to test occurs when the donor fails to appear at the collection site for a DOT test within a reasonable amount of time, as determined by the donor's employer. Call the employer's DER when an employee fails to appear for a scheduled DOT drug test. Failing to appear for a pre-employment test is not considered a refusal to test, but you still notify the DER. The donor leaves before the collection process is complete. Even if the donor has provided an adequate specimen, it is still considered a refusal to test if the donor does not complete all the required steps of the collection process, such as watching the collector pour the specimen into split specimen bottles. In a pre-employment test, it is not considered a refusal to test as long as the collection cup has not been selected. The donor fails to provide urine. Once again, an exception is made for pre-employment situations when the donor leaves the collection site before the collection begins. The donor fails to permit a required monitored or observed collection. As you may recall, a monitored collection is conducted when a collection is being done in a multi-stall restroom, when all other toilet enclosures are not prepared to prevent tampering. Meanwhile, directly observed collections are required when you are told by the donor's DER to conduct a directly observed collection, when you suspect that the donor brought items with the intention of tampering with the specimen, when you see signs of tampering with the specimen, or if the specimen temperature is out of range. The donor fails to provide a sufficient amount of urine without a valid medical explanation. In this situation, it is up to the MRO to determine if it is a refusal to test. As the collector, when the donor provides a specimen that is less than the required 45 milliliters, follow the shy bladder procedures discussed later in this section. The donor fails to submit to a second collection if required. This situation occurs when the MRO, employer, or the collector directs the donor to provide another specimen and the donor refuses. If you have directed the donor to submit to a second collection and he or she fails, note the refusal to test and notify the DER. When the donor fails to cooperate with any part of the collection process. If the donor refuses to empty his or her pockets, behaves inappropriately, refuses to wash his or her hands, or disrupts the collection process, stop the collection and note the refusal to test. In observed collections, donor fails to follow observer's instructions. If the donor does not lower and raise clothing as required and turn around to prove that he or she is not concealing a device that could be used to interfere with the collection process, it is a refusal. The donor is wearing or possesses a prosthetic or other device that could be used to interfere with the collection. If you discover a prosthetic or similar device, note this as a refusal to test. The donor admits that he or she has adulterated or substituted a specimen. If the donor tells you, the collector, or a medical review officer that he or she has adulterated or substituted a specimen, it is deemed a refusal to test. Although the following refusal to test situations are outside the collection scope, they are provided to give you a more complete understanding of the refusal to test scenarios outlined in Part 40. The donor fails to undergo the required medical evaluation. As part of the testing process, the donor may be told by the MRO or DER to undergo a medical evaluation. Refusing to follow these instructions constitutes a refusal to test. The MRO has verified that the donor provided an adulterated or substituted specimen. In this situation, the result is a refusal to test. A shy bladder procedure occurs when the donor is not able to provide a sufficient amount of urine for a drug test within the defined time frame. At least 45 milliliters of urine is required for a DOT specimen. The urine cannot be combined with another void to produce a sufficient specimen. Once a donor arrives at a collection site, begin the collection process without delay, even when the donor tells you that he or she cannot provide an adequate specimen. Tell the donor that he or she needs to at least attempt to provide a sufficient specimen. Explain that most people are able to provide the required 45 milliliters of urine, even when they think that they won't be able to urinate. Even when the donor tells you that he or she will not be able to provide an adequate specimen due to an existing medical condition, you must still begin the collection as if it were a routine procedure. It's up to the medical review officer, not the collector, to determine the validity of the donor's medical explanation for not providing an adequate specimen. This will occur during the medical review process, which occurs after a collection or an attempted collection. After you've completed all the preliminary steps of the collection process, provide the collection cup to the donor and instruct him or her to go into the restroom to provide a specimen. Remember, the donor needs to demonstrate his or her inability to provide an adequate specimen by attempting to provide a specimen. The shy bladder procedure kicks in when the employee exits the collection room with an insufficient quantity of urine or an empty collection container. When the insufficient specimen is not out of the acceptable temperature range and shows no signs of adulteration, you must follow the shy bladder collection procedures by discarding the insufficient specimen and noting the time on the remarks line of Step 2 of the CCF. If no specimen was provided, the collection container may be used for the next attempt. As the collector, you must explain the shy bladder collection procedures to the donor and encourage him or her to drink up to 40 ounces of fluid that are reasonably distributed over 3 hours. It is not considered a refusal to test if the employee declines to drink. Tell the donor that he or she must remain at the collection site until the process is complete, and that failure to do so is considered a refusal to test. As with all refusal to test situations, note the donor's refusal and inform his DER immediately. During the 3-hour period, the donor must be monitored by the collector or another responsible collection site employee at all times. Continue using the same CCF, being sure to document the time of each attempt, the amount of the specimen, and the amount of fluids the employee was given to drink on the remarks line of Step 2 of the CCF. If the donor provides a sufficient quantity of urine within 3 hours, follow the routine collection procedures to prepare the specimen for shipment to the laboratory. If the donor fails to provide a sufficient specimen within 3 hours of the first unsuccessful attempt, you must discontinue the collection. Make a note on the remarks line in Step 2 of the CCF and immediately contact the DER. Once you have entered into the shy bladder procedure, regardless of whether or not the donor ends up providing a specimen of sufficient quantity, you must send copy 2 of the CCF to the MRO and copy 4 of the CCF to the DER. These copies must be sent or faxed to the MRO and DER within 24 hours or the next business day. The collector's copy must be stored at the collection site for at least 30 days. Collectors are generally permitted to do only one collection at a time. However, due to the length of some shy bladder situations, you may perform a collection on another donor while the first donor is in the shy bladder situation. While you are busy with other collections, another collector or a responsible collection site employee can keep an eye on the donor in the shy bladder situation. Occasionally, completing a shy bladder collection will require 2 collectors. In such a situation, a second collector would perform any subsequent collections and complete the collection process. When 2 collectors participate in a shy bladder collection, the first collector documents the start of the 3-hour waiting period, and the second collector acts as the collector of record. The collector of record writes and signs his or her name in Step 4 of the custody and control form. The remarks line in Step 2 of the CCF is used to document the name of the first collector and the date and time when the procedure was transferred to the second collector. The collection site must provide the donor 3 hours to produce a sufficient urine specimen, even if it means the facility must remain open past its usual closing time. When the temperature of a specimen is not in the acceptable range, or there are signs that the donor has tampered with or plans to tamper with a specimen, you must perform a collection under direct observation. Following is a thorough discussion of both situations. One of the first things you must do after a donor hands you the collection cup is to check that the temperature of the specimen is within the acceptable range of 90 to 100 degrees Fahrenheit. This step must be completed no later than 4 minutes after the donor gives you the specimen. When a donor provides a specimen that is not within the acceptable temperature range of 90 to 100 degrees Fahrenheit, you must perform a second collection under direct observation. You will need to process and send both specimens to the laboratory for testing. Finish processing the first specimen before beginning the second collection. While filling out the custody and control form for the first specimen, check the No box in Step 2 to indicate that the temperature was out of range. In the Notes section, reference the specimen ID number of the second collection's CCF. Next, begin the second collection under direct observation. On the custody and control form, be sure to reference the specimen ID number of the first specimen. Process the second specimen and properly distribute the custody and control forms for both collections. Fax or send via email copy 2 of the CCFs to the medical review officer and copy 4 of the CCFs to the donor's DER within 24 hours or the next business day. As soon as possible, you must inform the donor's DER and your supervisor that you performed a collection under direct observation. You must also explain the reason why the direct observation collection was performed. If the donor refuses to provide another specimen under direct observation, notify the donor's DER as soon as possible. This is a refusal to test. In this situation, discard the first specimen provided by the donor. The first specimen is not sent to the laboratory for testing when a donor refuses to provide another specimen. Besides checking the temperature and volume of the specimen, you must inspect the specimen for signs of tampering and adulteration. The presence of an unusual color, foreign object, or material is a common indicator of tampering. After the donor hands you the specimen, examine it closely. Is the specimen blue? Does shaking it produce excessive foam? Does it smell like bleach or apple juice? These are a few common signs of specimen tampering. If you see any signs of tampering or adulteration, you must immediately conduct a second collection under direct observation. Both specimens must be processed and sent to the laboratory for testing. Even when the volume of the first specimen is insufficient, the specimen must still be sent to the laboratory if there are any signs of adulteration or substitution. The final problem collection that we will discuss in this section is the donor's refusal to certify that the specimen is his or her urine. Even after they've provided a urine specimen, some donors are reluctant to certify that the specimen is theirs. Refusing to sign the CCF or initial the specimen bottles does not invalidate the specimen or the test result. It doesn't result in a refusal to test either. When the donor fails to initial the bottle seals, note it on the remarks line in Step 2 of the custody and control form. Then complete the collection process as you would for a routine collection. In situations where the donor declines to complete Step 5, the certification statement, note the refusal to sign on the remarks line on Step 2 of the custody and control form. Step 5 asks the donor to provide his or her name, birth date, signature, and daytime and evening phone numbers. If the donor refuses to fill in any of this information, you must, at a minimum, print the donor's name on the appropriate line. This is not considered a refusal to test. As the collector, you are responsible for ensuring a successful collection from each donor. This section discusses the 4 types of collection flaws. They are fatal flaws, which result in a canceled test; correctable flaws, which must be corrected to prevent test cancellation; errors that require corrective action; and errors that require no corrective action. Collection errors may subject you to error correction training and could put you at risk for enforcement action during an auditor's review. When a collector error causes a fatal flaw, or when you fail to provide a written statement in a correctable flaw situation, you will be required to undergo error correction training. This training will address the specific area that caused the test to be canceled. The training must be completed within 30 days. If you become aware of an issue that would interfere with a valid collection or test, try to promptly correct the problem. If necessary, you may begin another collection as part of this effort. Once the employee has left, you cannot recall him or her for another collection unless you learn that a directly observed collection should have been conducted. This is the only exception. In this situation, you must notify the employer to tell the employee to return to the collection site for an immediate recollection under direct observation. When another collection is necessary, begin the collection as soon as possible. Be sure to use a new CCF and collection kit. Let's listen in as our experienced collector, Tony, tells Contessa about the 4 types of fatal flaws that will cause the MRO to cancel a DOT drug test.
So, What collection site errors cause a DOT drug test to be canceled?
Great question, Contessa. 4 errors that always cause a DOT test to be canceled are called fatal flaws. When the MRO cancels a test due to a fatal flaw, the individual who performed the collection needs to complete error correction training.
What are the 4 fatal flaws?
The first one is when both the collector's name and signature are omitted from the CCF. Let me show you. On Part 4 of the CCF, you want to make sure that you print your name, sign, date, and indicate the time that the specimen was produced. Otherwise, there's no documentation as to who conducted the collection. Second is when the ID numbers on the specimen bottle and the CCF don't match.
How could I avoid that?
To avoid this fatal flaw, you want to make sure that you always use the tamper-evident seals located at the bottom of page 1 of your CCF.
Okay.
Next is when the specimen seal is broken or shows signs of tampering and the split specimen cannot be redesignated.
How could I prevent this?
You want to always make sure that after the donor initials the bottles, that you double check the seals before preparing them for shipment. Finally, due to leakage or another cause, there's an insufficient amount of urine in the primary specimen and the secondary specimen cannot be redesignated.
But what can I do to make sure the bottles don't leak?
You want to make sure that you tightly seal the bottles and always make sure that you properly package them for shipment.
The following correctable flaws must be corrected to prevent the cancellation of a DOT drug test. Either the collector's signature or printed name is missing from the certification statement on the CCF. When this error is discovered, the laboratory will attempt to make the correction by contacting the collection site. The donor's signature is missing from the certification statement, and the failure or refusal to sign is not noted on the remarks line in Step 2 of the CCF. Use the remarks line for all situations that deviate from routine collection procedures. In this case, the MRO will contact you. The collector uses a non-federal form or an expired federal form for the test. This is a correctable flaw as long as the collection process has been conducted in accordance with Part 40 in a Department of Health and Human Services laboratory. The following error must be corrected. However, it will not result in a canceled test, even if it is never resolved. The collector did not check the appropriate box to indicate if the specimen temperature was within the acceptable range and did not include any remarks regarding the temperature in Step 2 of the CCF. Though not a fatal flaw, this error may still subject you to enforcement action. The following errors, which do not require corrective action, must be documented if discovered. This documentation may be requested as part of an administrative or legal proceeding. Collectors, other service agents, and employers may still face penalties for these non-fatal errors. A minor administrative mistake. Examples of these mistakes include a transposition of the numbers in the donor's Social Security number, misspellings, or the omission of the donor's middle initial. An error that does not affect employee protections under 49 CFR Part 40. For example, the collector fails to put the bluing agent in the toilet bowl. Although this misstep would interfere with your ability to detect specimen tampering, it does not impede the donor's rights in the collection process. The collection of a specimen by a collector who has not met the training requirement for DOT collections. A delay in the collection process. The failure to directly observe or monitor a collection when required, or failure to follow the proper procedures for this type of collection. The collection was conducted in a facility that does not meet the Part 40 requirements. The specific name of the courier on the CCF was omitted or incorrect. Personal identifying information was inadvertently written on the CCF. As an example, the donor's name appears on copy 1, the laboratory copy of the CCF. As the collector, You must make every attempt to correct an error in the collection process. When you discover an error, correct it promptly. This applies to both paperwork and procedural problems. In later stages of the testing process, the laboratory and MRO are also responsible for identifying and trying to correct collection errors. You will want to make sure that the correction will rectify the problem. If necessary, you may begin a new collection, as long as the donor has not left the collection site. There is one exception. When a collection should have been conducted under direct observation and was not, you must call the donor back to the collection site for another collection. The accompanying manual details the corrective action that must be taken to address common collection errors. Scenarios covered include omission of required information, use of expired or non-federal forms, and broken bottle seals. Review this information now to familiarize yourself with the necessary corrective action and refer back to the manual if you make a collection error that requires corrective action.
Well, Tony, thanks for taking the time to explain everything to me. With a little practice, I think I'll be ready for my mocks.
No problem, Contessa. You're doing a wonderful job. Just let me know when you're ready to do your mocks. You want to make sure that you're comfortable with the collection procedures so that you don't make any errors. If you make an error, you'll have to start the mocks all over again. So do you have any questions?
No, not right now, but let me just make sure I've got this straight.